Hello, good evening, and welcome to Heartfulness Wellness webinar today. Today's topic is pain and movements in life. This session is about physiotherapy and its importance these days. Many of us live with pain we are not aware of, and they do impact our productivity in day-to-day activities. It's not just related to elderly population, but now youth is also facing the same challenges. To educate more on us, we have two respectful speakers today with us, and I would like to welcome Dr. Aarti Prasad and Dr. Vaibhav Daga. Dr. Aarti Prasad is HOD of Physiotherapy Department, Ramakrishna Group of Hospitals. She has been working as a physiotherapist for 35 years and qualified trainer for Matrix Rhythm Therapy and Theraband Academy. She has conducted 55 workshops for physiotherapists all over the country and has been awarded as Best Doctor by Rotary Club in 2007. And she has been given Lifetime Achievement Award by BPN in 2017. She has given the Women Achievers Award by Garden University in 2019. She is running fitness classes for Geriatric groups also. So welcome, Dr. Aarti Prasad. Now,
Hello.
welcome. Dr. Vaibhav Daga, consultant sports and musculoskeletal physiotherapist. He's a head sports physiotherapist and consultant sports medicine at KDAH Center for Sports Medicine. He also worked with BCCI, Delhi Daredevils, and national cricket teams and National Cricket Academy as a team physiotherapist, and has been awarded as the best sports physiotherapist at the ATP Conclave in 2015. And also Young Achiever Award by IAP Annual Conference in 2015. Welcome, Dr. Vaibhav Daga.
Thank you.
And now I hand it over to you both this session. Thank you for joining us today.
Thank you.
Hello. Hi. So, good evening, everybody. Here we are gathered here to speak about pain and movement. How does pain and movement play a part in our lives? How can pain play a part in our life, and how we can stop pain by doing movement? This is what I'm here to discuss about. And basically, if I can see what is pain, let us talk about pain first. What is pain? The pain is basically an unpleasant sensory and emotional experience. According to the traditional definition, it is an emotional, sensory and emotional experience associated with actual or potential tissue damage, or described in terms of such damage. It basically concerns about tissue damage, but sometimes with the extent of tissue damage, even the pain sometimes is not there. You don't feel the pain, and sometimes with a very little tissue damage, you feel more pain. So it's a complex, it's not very simple to understand pain. So we a little bit know more about the pain ahead as we go to the next slide. What's the nature of pain? Pain is subjective and highly individualized. Its stimulus is physical or mental in nature. It interferes with personal relationship and influences the meaning of life. Only the patient knows whether the pain is present, and how the experiences feel may not be directly proportional to the amount of tissue injury, as I just covered in the first slide. So maybe the tissue injury is very small and pain is very large. Sometimes you can feel the pain a lot. Sometimes there is extensive tissue injury and you feel no pain at all. Sometimes that's why sometimes when you have MRIs taken, and you many a times find incidental findings, as we call it in our medical terms, that you found an incidental finding of a disc popping out if you take an MRI of a spine, or some degeneration happening in your joints. But the individual or the subject doesn't have a great pain from that kind of a tissue damage. So it's very possible. Let's see what are the types of pains we have in our lives at the moment. Pain is basically classified on basis of duration, location, intensity, and etiology. Etiology is basically the cause of pain. So if you go further, the duration of the pain, basically the pain is divided into a shorter duration pain, which is acute, which is immediate pain. It's sometimes, a pain which you get at once when you get injured is called as an acute pain. A long-standing pain is called as chronic pain. I won't like to go into the details because this is not the platform of what to discuss about pain so deeper. I just wanted to give you an idea. There is an acute pain, there is a chronic pain, and the chronic pain basically is further divided into non-cancerous, cancerous, and episodic. So non-cancerous is basically a pain which is not from cancers forming cells of pain, or cancerous pain is basically cancerous pain as the name describes. Episodic pain is something which you get very at certain episodes. It comes in an episode and it goes off. It comes in an episode and it goes off. So a lot of times these kind of pains are examples like you getting, sometimes you get a backache. There is an episode of backache which happens due to some kind of an extra thing you did, or a wrong movement you did, or lifting of something you did. So this is called as an episode of pain, and it's called episodic pain. So that's the duration. Going ahead, pain is based on location also. So if the location in your body, if it is a headache, it is a back pain, it is a stomach pain, there's a cardiac pain, which is basically coming from your heart, stomach pain. There are referred pains. Referred pain, sometimes you feel a pain not exactly at the location where the injury is, but you feel it a little bit away from where the injury is. For example, if you take an example of the cardiac pain is very commonly coming on the left side of the inside of the arm. Though the heart is placed right here in the center towards the left side of the sternum. So that's how you can feel the cardiac pain. Similarly, sometimes you feel some lung pain or the respiratory pain in the right part of the shoulder, or some acidity pain or the stomach or the gastritic pain. You can feel anywhere in the abdominal area or somewhere else. So there are referred pains. So that's why the pain can be classified on location also. Then pain is is further classified into intensity, because of the intensity what you face. So there is a mild pain, moderate pain, severe pain, depending upon the intensity of the pain. Mild pain, usually you have a visual analog scale which is there, which we in our world call it as, if you have pain, we ask the patient to rate the pain on a scale of 0 to 10. 0 is kind of no pain at all, and 10 is like the worst ever kind of pain you ever felt anytime. And accordingly rate his present pain on that and give a number. So if the number is in between 1 and 3, it's supposed to be mild. If it is between 3 and 6, it's supposed to 3 and 7, it's supposed to be moderate, and above 7 is usually a severe pain. Based on etiology, there are two types of pain: nociceptive pain and neuropathic pain. They both are central and peripheral. Etiology is basically cause of the pain. Nociceptive is basically some kind of a nociception which you feel at the periphery, something hitting you, something piercing you, something poking you. This is kind of a nociceptive pain. Neuropathic pain is basically from the nerves. There is no reason for it. There is kind of compression of the nerve. There can be an elongation of the nerve. There is a stretching of the nerve. So these are the kind of pains you feel you have because on the basis of etiology, that is the cause of the pain. What's the purpose of the pain? So that is a little bit description of how the pains are felt. What are the different types of pain you feel? What is the purpose of pain? First and foremost, the purpose of the pain is protection. It's basically prevents further damage to our particular part involved there. As you get the pain, you basically stop or cease movement. You basically try to avoid movement. That avoidance of movement helps you to protect that particular part. For example, you are just walking on the road, and on the foot, on the road there is a nail, or there is some kind of a pointed object which pierces your skin on the sole of the foot. You immediately stop and lift, and there is a there is kind of a ouch, or there is some kind of a noise which comes from. It's kind of an alarm also. It's a basic alarm system. So it gives you an alarm that something is wrong and you should not be doing it, and you should stop it. You should stop that particular activity, or get yourself away from that place, so that you're not further having the pain, and it will protect you. So that's the purpose of the pain. So pain is sometimes helps you, not sometimes, always helps you in protection, preventing the further damage by setting up an alarm in the body and giving you that alarm when the attack happens, or when the nociception on the periphery happens. So just depending on that, we know what the pain is. It is an unpleasant sensation we talked about. What's the modern view of pain? We talked about it's an alarm system. It's a fabulously complex alarm. Pain is basically felt at, it is processed at 3 different levels in our body. It's the cortical level, which you can see here right now. It's the cortical level. The central sensitization, it is somewhere in the spinal cord, and this is the peripheral sensitization. So what exactly happens in this picture, if you see, this individual man is near the burning fire. He's feeling the burn here. The nociception is felt here in the periphery. But how does it reach the brain is the process, how the information is processed here with an inflammatory reaction, passes the signal to the at the central level, which is the spinal cord level. There is a spinal cord, and the spinal cord has a dorsal horn and a ventral horn. I'm not going to go into the details of how the pain is processed and how does the brain understand about the pain. But this is a basic thing. Once you feel the pain, it gives a signal right up in the center in the spinal cord. And then at this central processing unit, the central sensitization, it decides, is it such a pain which is going to need the brain to understand that. Brain is basically the powerhouse. So if you basically talk about, if you talk about security systems at an airport, sometimes when you enter the airport, there are all security check is done with you, and if something is going wrong, or somebody feels something that there is a suspicious movement by somebody, or some of the passengers, or one of the group, then the security personnel will basically are aware of it, or are made aware of it. And that made aware, these are the security personnel, that is the central sensitization. They basically understand that there is a danger happening, and possibly then they decide if it is such a danger that it can be sorted out with themselves at that level, or it should be further reported on the higher level, which is the brain. So in that sense, this is the analogy I would put together to understand how the pain is processed. So if you go further, peripheral sensitization, as I said, that there is a tissue damage which is felt. There are various chemicals and mechanical action happening at that level, which will there is a lowered of firing. The threshold is your threshold is beaten, and then it basically it is over the threshold, and that's how you will start feeling the pain. And that signal will go to the spinal cord, and that at the spinal cord level, it will be processed further to act on it, or basically pass it further to the brain, so that the brain can act on it if it is not in their capacity to act on it. Similarly, if the severe injury may create memory of the trauma. So if the trauma, for example, an ankle sprain, the first time you get an ankle sprain, usually it will be pain, and you will protect yourself. You will limp. The limping is part of the protection. So you will walk with a limp. You understand that there is a damage into the tissues of around the ankle, and that will give you that peripheral sensitization. But this kind of a pain will create a memory for further. So if you have another kind of an ankle sprain, sometimes you might, sometimes the brain might process it, or the spinal cord at the level will process it and say, okay, this has happened before, and it may not give you the limp. It might just give you, ask you to move the ankle in a proper way and then continue your activity. So it depends. I mean, that's how it is, the peripheral sensitization. Central sensitization, it is called as the mini brain in the spinal cord, acts as a gate on the nociception. So it will basically block the nociception at that particular level, or it will pass it further to the brain to act upon it so that you can be prevented from doing any further damage to your involved part. So it can change where the sensitivity. A normal response, it is a normal response to an injury. Sensitivity may persist even after injury, if at the central sensitization. So you can understand that injury further, and it will, it will give you the sensitivity in the long run. What happens at the brain? Basically everything is processed at the brain. So in the brain, it will ask, how dangerous is this? Is the pain necessary for protection? That's the questions brain will ask, and it will basically act accordingly. Weighs all possible evidence of the threat which is coming your way. I mean, the nociception, basically the nociception is basically is kind of an injury or kind of a nociceptive stimuli which is on the periphery, which will make you understand the nociception. And with the past memories, as I said before, it will act upon it. If it is something which they have experienced it before, they might not act vigorously on it. Maybe there is no, for example, as we talk about the ankle sprain, possibly the limping may not be there. The limping will get very cured very soon, and the movement is better. Though there will be some kind of an unpleasant sensation, but your actions will be improved. Other sensations, it will of course, as the brain, because sometimes, for example, if you injure your knee ligament, there is a pop heard, there is a crack heard about the ligament. So that's an auditory response, what you heard. That sensations will also help the brain to understand how bad is the injury, and accordingly it will respond to the pain. Similarly, the brain will also have cognitions to understand. It will be affected by emotions, motivations, and different expectancies. So the emotions also control the pain completely a lot. So for example, if you're stressed too much, the pain will be felt too much. If you are in a happy mood, possibly in that particular mood, you may not feel the pain. Take an example of a sportsman. When usually they're playing the sport, they are in the game, and they do get injured. Sometimes they will feel, but because of the adrenaline rush, or because of that emotional thing what they have, that they have to complete that particular sport, complete that particular game, they may not feel it, but after when they rest, they will feel the pain. So that's how the brain works. So in the modern day, pain is multifactorial. It is the modern pain is basically biopsychosocial. Bio is basically peripheral factors like the tissue damage, the injury, the inflammation. That's the bio part of it. Then the psychosocial is the perception of that particular pain, the thoughts and emotions attached to it, the social stress. These are all depending on these things. The pain is processed, and you will understand. So as a whole, when we start treating the pain, it's not only about the injury and inflammation. There are additional factors of the psychosocial factors which have to be considered when we try to treat the pain. So in this example of the picture, it is given when there is a nociception, there is a pain, the interpretation of threat of pain is there, pain control is there, fear. Because of the fear, you avoid to move, and because of the avoidance of the movement, there is interference, disability, and negative effect of the movement, and further pain is caused. But at the same time, if your approach is totally different, and you move properly with a positive effect and with optimism, you can recover faster. So that's how pain can be dealt in two different ways: with a negative effect, with a positive effect, with a trait and anxiety. When pain it will be a catastrophe if that kind of effect is there. But if there is optimism, possibly the pain is much better, and you heal from the pain better. So coming to that, I would like to put a light on what is movement. Movement is basically is motion, is the state of changing some position, something's position. So movement affects everything from circulation to digestion to metabolism to immunity. With movement, our body regulates hormone activity, detoxifies us, and gives us good respiration. So the way you move, it is better for you. So movement is basically about life, all about life. If you don't move in life, it is going to be stagnant. Your life will be stagnant, you yourself will be stagnant, and the pain will be there more and more because of the lack of movement, as I said. So benefits of movement. If we go further and check what happens and what are the benefits you get from movement or for per se exercise, it helps to turn the pain volume button down by accessing the body's own inbuilt pharmacy. So you don't need any drugs to really to suppress the pain, but the movement also will act as the inbuilt body pharmacy, which will help the pain to get better. It reassures you some pain with movement is okay and does not mean you're doing harm. As I said, I mean, it is definitely the best thing about our body is that as you get injured, there is an inflammatory process which is switched on. And as that inflammatory process is switched on, the healing of that particular tissue which is damaged starts. So as the healing starts, the healing is going to progress unless and until you stress onto it and damage it further. So as I said, some pain with movement is okay. So whatever available range of movement you have, how much ever you can move, you should move. And it is encouraged in these modern days to move, to actually work on the pain. The optimal loading, as we call it in our medical world, it is kind of proper loading. Whatever is required, whatever is available is to be done. It keeps you active and capable of doing what you want to do, helps regulate sleep patterns. Movement, exercise will help you sleep better. It will reduce stress. It improves your mood, especially if you're depressed, and if you exercise well, you move well, your mood is improved. It improves your immune function, very important in these kind of days where you're facing COVID-19, the coronavirus, you're mostly homebound. Your body's ability, your body's ability to fight infection is immune function. But because of your sitting, you're not moving much, you're not doing much of an exercise, possibly many of them. I'm not saying everybody is doing that. Most of them are taking care of themselves by doing some exercise because of understanding about all these things. But yes, the immune function is improves if you move well and if you exercise well. It's good for your general health of your heart, lungs, muscles, and joints. It helps to control weight, and of course keeps a healthy brain as you age. So movement has all these kind of benefits. So you definitely need to move to gain all these benefits. Yes, pain does stop movement. All right. Pain, movement, as it says, is relaxing, stretching, walking is important for your health and a big part of pain management. Remember that movement and exercise are only one important piece of the pain management jigsaw puzzle what you have. It's about the pacing of the movement. It's about the beliefs what you have. It's the care what you provide are the other jigsaw puzzle. So all these coming together will help you to move better and help you to stop that pain which is occurring because of non-movement. Right, that gets me to ask a question. Is there a right type of exercise for you? Yes, there is. But again, there is no only one size fits all. There are various exercises. It has to be, it requires 3 to 4 main types. Good for your health exercise, which is like your cardiovascular, your aerobic exercise, walking, cycling, swimming, and etc. As we go further. And then there is relaxation and stretching exercises. Then there is strength and conditioning exercises. There are balance and agility exercises, very important balance exercises for the geriatric population, which Aarti ma'am is going to speak about in a while after me, how it is dealt with them. So getting started with exercise, finding the right times to start. There is no right time to start. You can start exercise right at this moment. So if you're motivated enough, you know what to do, you can immediately start exercising, start moving. I mean, it is not that you have to do high intensity exercises immediately. You go from pace to build up the pace. That's why I said the pain management is about how to pace yourself up, how to accommodate various certain movements, intensity of those movements, and start the exercises. Taking up the challenge. When you start exercising, it's a challenge to your body. It is not going to like it because it will respond with soreness. Every exercise you do, the response is with some soreness, some kind of an ill effect of soreness, but that soreness is a good soreness. So if you sit home or if you just sit down, that's saying that there is soreness, you're going to be further sore and further immobile, and it is going to cause more pain. So it's better to move around in that soreness, get used to that response, let the brain adjust to that kind of a response. It will understand the pain, and you take up the challenge to keep on moving ahead. What can I expect when I start exercising? As I said, you can expect this soreness for sure, these difficulties in these movements, particular movements you might not be able to do depending upon your agility, depending upon your flexibility, depending upon your understanding of that particular exercise, depending upon your capacity, your brain capacity to accommodate that response of the exercise, and it will give you those responses of soreness, of pain, of a little bit mild pain, stiffness, all these kind of things. But and it will urge you to stop. But if you keep on moving and keep movement better, it will definitely help you to overcome all these things and be fit enough to exercise well and avoid pain in life. Okay, so what are the examples? These are the various examples of various exercises I can see. You can see here, if I just play the video, endurance, cardiovascular, there is walking, there is running, there is swimming, there is cycling, there is resistance training. All these are the different types of exercises which you can basically do. So you basically, when you talk about exercises, how do you target exercise? There is a maximum heart rate what you need to calculate. So for example, if you're 35 years old, you 220 minus 35, that is 185, that is your target heart rate. That is your 100% target heart rate. So you definitely don't work, gives you an estimate of your 185 heart rate beats per minute. So these are the various zones. If you can see, there's maximum 90 to 100%. That is the zone where you basically don't work. You usually work into 92 to 111 beats per minute or in that range for your cardiovascular response. And these are the exercises. You also have these various perceived exertion scales, which you can which you can think, which you can basically refer to. It is different for different people at different fitness levels. So if the exercise is too hard, you can back off. If it is too easy, you can improve yourself. There are lots of gadgets available these days. The watches are available, the phones are available. So it should give you both kind of, it should help you to perform in that particular target heart rate, and it should give you a perfect response of your exertion. Exertion should not be maximum. It should not be too light also. It should be adequate. So depending upon your age, your physical capability, you can decide what cardiovascular exercise is the best and accordingly work on that. Then further, there are cardiovascular exercises of high intensity, which is called as HIIT, high intensity interval training. These are also the various exercises. If you see, it's a high intense exercise where, as this lady is doing, like the toe touches with a side plank oblique crunch. These are the HIIT exercises. The best HIIT you can do at home without any equipment or with just a skipping rope. So jump ropes, burpees, jumping jacks, squat jumps, kickboxing, dancing, running the stairs, jogging on the place. These are the various ways you can immediately start doing. These are also high intensity interval training. And these are the various kinds of short burst cardio. It's basically a short burst cardio exercise. It is done over a short period of time, and the cardio intensity is higher in a moderate to maximum level in between that. That's what you target with, and that's how it will help you to accommodate to your exercises and help you to build up good cardio as well as good intensity of cardio. So these are the various examples. You can see that a downward dog with the knee push-up. So a body, she's not using any equipment. It is only the body which is being used. You can do a lot of things through these, and ensure, of course, you have proper intensity. I mean, you cannot start with immediately. As you saw, she started with a very low intense workout, and now her intensity has increased into this HIIT zone also. Similarly, there are relaxation and stretching exercises. There are examples of Tai Chi. If you see, these Tai Chi exercises are basically with your breathing control. You breathe in and sink your breath out. You do various poses of Tai Chi. There is yoga, which helps you in stretching and relaxation. These are the form of exercises which will improve your flexibility. It will give you also stability and strength. And of course, your breathing control, your breathing capacity increases in all these kind of exercises. Similarly, there are body weight exercises, there are strength and conditioning exercises, which we talked about. So various body weight exercises you can do without even having any equipment. You can do jogging, you can do push-ups, you can do mountain climbers, you can do bridging, you can do your alternate toe touches, you can do basically a split squat jump. You can do a bend over deadlift or a RDL without any weight. You can do jumping jacks. So these are the various body weight exercises you could do and to start with for your strength and conditioning. So if somebody's starting into strength and conditioning, it has to be starting into some kind of a body weight exercise. Also, for example, you can use TheraBand, the exercise bands, what you get in the market these days. If you can buy a few exercise bands and start working on it as you do with your body weights. I mean, here we are showing about the weight. I'm showing you about the weight training where you use the dumbbells and the barbells to do various upper body and lower body exercises. Instead of this, you can use the bands to work out. Similarly, you can use kettlebells, which are a new thing to start, and people are using a lot to do the kettlebell exercises. They are again strength and conditioning exercises, which will make you gain strength. So these are the various exercises and movements possible, and these are you should look up to for to doing these kind of an exercises. Similarly, if your strength is good, you can progress to power and plyometric exercises. Plyometric are basically jumping exercises or a power band exercises where there is a resistance applied to you from behind and you're working against that resistance to do some side step, do some step ups, do the box side to side step. There, as you can see, there is a resistance. So you're basically working against the resistance of the band. This can be used as rehab exercises also when you're returning to sport. If you're somewhere injured and you're coming back to sport. So these are the ones before you really get back on the field. These are the movements you're challenged to do because these are very much required when you play a sport. These kind of hop and 90-degree turn, hop and 180-degree turn. These are jumpings and the plyometrics. They are explosive movements. They are powerful movements. These can be only done when you have a good strength base. So I would never suggest anybody to start doing these exercises right away. Start with building up with a good strength base and then progress to these kind of exercises. Okay. Then there are balance and agility exercises. Of course, I'm showing a lot of balance and agility exercises. This improves your balance. They are very sport specific exercises. You basically work on different platforms, unstable platforms to improve your balance. You definitely, if you don't have these equipments, you simply can stand on one leg, do a lot of balance stuff on one leg. If you're standing on one leg and you're using the football or catching your ball on one leg, that also improves your balance. So there are various ways to do it, but you can be creative, approach your health professional like a physiotherapist or a strength and conditioning trainer or anybody who knows about exercises, and they will be creative to make you get you going with these kind of movements, which will ultimately improve yourself, improve your fitness, and of course improve if you have any pain. And it will keep the pain away also if you're accommodated, if your brain understands that these movements are the ones which you're doing, and your body will be capable of doing these movements by doing these kind of an exercises. So that's the example. So finally, do more movement. That's what the idea is, and this will help you to stay away from pain. And and basically, movement is beautiful, exercise is beautiful, and it will help you not to go towards pain, or even if you have pain, it will get your pain cured at the earliest. Thank you so much. That is it from me. I would like Aarti ma'am to take it over from here and go ahead with the lecture. Thank you, Aarti ma'am. Please,
Thank you, Vaibhav. That was a wonderful presentation, and you really explained everything about pain. So I'm really not going to talk about pain at all. About the anatomy, the physiology, and all that of pain. So I'm just going to jump in straight into what all can be done for the geriatric population. I think what I really need to show them a lot is how exactly the geriatric population can get into some form of an exercise which is generally not wanted. I'm just going to look at what is the problem with the older adults. Till now, Vaibhav really talked very well about, and he gave us a lot of examples on how exactly we are going to improve movement and first pain, how the pain can be controlled by movement, how movement helps, and how this can be converted into exercise forms, the various exercise forms that can be done. Now I'm going to do something that is what exactly is happening with the geriatric group. Why am I not? Yes. Okay. Now all of us have to understand that the population is aging, and the anticipated population above 65 years will rise by 36% by 2050. And that's a huge number. And the potential is they're just going to be living longer with the kind of exercises that we are teaching them, with the kind of medication that is happening. So everything put together, people are going to be living longer. There will definitely be a more number of adults as we go further. And the world population data sheet classifies. What does it classify? Anybody above 65 plus is called as old. What does India say? India says the senior citizens are above the age of 60. Anybody above the age of 60 is called as senior citizen. Now we all have to remember, as we grow older, our intensity of energy comes down. You can see in the slide that we are at the peak level at 100 as we are activity level as we are younger, and slowly the slope comes down as we grow older. So what is happening is our energy levels are definitely changing. They are coming down. There is also another fact that we have to remember, that even with a lot of physical activity, there are going to be certain physical effects of growing old. And we have to understand that the average adult's strength reduces at the rate of whatever percentage at the decade of 30 years, and this increases to 15%. That is 5%, and this is 15% per decade by the time you start 60 years. So you can imagine the way there is going to be a downfall of strength as we grow older. So people who are in the geriatric group are going to grow older faster. That is 15% per decade, and that's a huge number again. Coming to what are the common problems that we see in the older age group. What is it that causes so much pain, aches in the older people? Generally, it is a joint pain, which all of us agree on. There is a lot of inflammation. It can be in the fingers, it can be in the knees, it can be the hips, spine. Early morning stiffness is one of the most common complaints that we see. Back pain, knee pain, neck pain, nerve pain. So how are we going to handle it? That is what we are really looking at. Now, older adults can have pain problems. Plus they have comorbidities. That means they have hypertension, they have diabetes. So many associated problems are there for the older adults. And in older adults, the pain is generally managed very badly. I will give you a simple example. When you think about pain and a patient comes to you who's about 80 years and the patient says that I have pain in my shoulder, in my neck, in your back, the first thing the doctor would always say is, oh, you're growing old, so you're going to have pain. But that is not the fact. Pain is pain. Pain can be because, as Vaibhav explained, it can be because of tissue injury, it can be because of tissue damage, it can be because of the socio-economic surroundings, but the pain is felt, the pain is understood by the person. I will give you a simple example for this. One old person, geriatric patient, went to the doctor and he told the doctor, doctor, I have leg pain, which is going down from my spine. And the doctor said that, oh, don't worry, you're getting old. But the doctor, he said, doctor, but I have pain only in one leg. What about my other leg? Is it also getting old? So you have to understand that we cannot dismiss the pain of an older person. Pain is felt. We have to understand from where the pain is coming, analyze it, understand it, and then according to it, give the solution to the person. The impact of the chronic pain is always more in older adults than the younger counterparts because there is a social isolation, and this is the social factor that Vaibhav was talking about. Pain is always felt more. What do I mean by attitudes and barriers? Attitudes, I will give you a simple example again. My mom is 88 years old. And if she does not complain of pain, it is because it is inborn in her and it has been told to her at a younger age, you cannot complain of pain. You have to tolerate pain. This is the way we were taught. But the younger generation that is there is not taught like that. They are told to voice their pain. But the older generation are very stoic about it. And now what is the problem when this kind of an attitude occurs is this converts itself into something that is called as a chronic pain, which Vaibhav just touched. So he also talked about how chronic pain can occur. And this is one of the reasons that the chronic pain can occur. You have to understand that the older generation does not want to express their feeling because first, people might not listen to it. The doctor might dismiss it. Or the doctor might give medication which will not suit them. They are scared of that. It's a multifactorial thing with the older people about aches and pains. So the most important thing is build reserves at a younger age. Accept pain, work on it. How do we build reserves is what I'm just going to be mentioning about in the next. So as I said, this slowly converts into a chronic pain, and chronic pain is there in older adults to a great extent. Now, what is chronic pain? Chronic pain is done which lasts for years and it can occur without any injury or illness. This is what Vaibhav really went on telling, that it's about the whole process. It is about the neural tags that are there present. in the brain, and which always anticipates pain, which always tells you with a previous injury how you anticipate pain for the next injury. So remember that it can occur even without any injury or illness, and it is up to us how we are going to handle that pain, how we are going to tackle that pain, and how we are going to relieve that pain for the patient. So we come to one thing, that a multimodal approach is very, very important in approaching pain for the older adults. So you have a drug drug introduction to the patient to reduce the pain, and it also is a non-drug modality. So we have to look at the various pain managing strategies or coping strategies. Now, there are cognitive coping strategies that can help to a great extent in all the older adults. We also have medication, physiotherapy, and exercise. I was going through a lot of research, and in this research, they said exercise is the least preferred. That means people do not want to exercise. And we really need to we as physiotherapists and exercise specialists need to make the exercises very interesting for the older adults, and then attract them towards the exercise program. The other important factor that we have to understand about the older adults is the older adults try to manage their pain in their own selves, and because they think they are in control. They've been so used to controlling their lives that they don't want to give up on this. So we come to what kind of exercise regime that the older adults can do for betterment of their pain. Vaibhav, thank you so much for really explaining the whole chain of pain. I'm just not going to get into it at all. I'm just straight away going to jump into exercises. And what are the kind of exercises we are looking at? Tai Chi. Tai Chi, the most important part about Tai Chi for the older adults is the balance. Tai Chi teaches balance. It is one of the important form of exercise where you have controlled movements, and there are a lot of controlled movements on single leg. Vaibhav showed examples of that. Then you have aerobic exercises. Aerobic exercises are something that I really teach my geriatric classes a lot, and I will show you some examples of it as we go further. Water aerobics is a very, very important aerobic activity because it creates a lot of fun for the older population. Dance again is very important. Walking, as all of us know, oh, we just love it. Everybody's recommended walking. Absolutely, please go ahead. Yoga is another very good form of exercise, and we also look at swimming. Now, always remember, for the older adults, the exercises have to be, the base programs have to be at a lower cost, and they should be accessible to the community. Tai Chi and exercise programs should be taught by a very good instructor. It is extremely important. What does the WHO recommendation say for the older adults? The WHO recommendation is it has to have at least 150 minutes of moderate endurance exercise per week is what the WHO recommendation says. Now, what does regular exercise do? It helps balance, flexibility, it brings agility and strength in the older age. It also improves, as Vaibhav mentioned, it looks at chronic ailments, many impairments, functional deficits. Cognition is one of the important things that it really improves, and whatever problems are there in sedentary lifestyles. We all know it is very good for diabetes, it's very good for cardiac conditions, it's also good for arthritis. So we all know what are the good effects of exercises. Now, these are some of the articles that I have put forward in, because I went through a lot of articles for this. For older adults with, they did an uncontrolled study in for a group exercises. So what we had found is group exercises versus individual exercises. The group exercise programs for the older group people, it was very, very good. And there was a lot of significant improvement in their functioning. What did we see? Another study that I went through, and they found that even with these group exercises, when there was a physiotherapist who kept calling them continuously to find out how they were doing, motivating them, that group improved much better than the other group. So along with the group exercises, if we can motivate the person, it showed a better quality. Because one thing I have found, since I run a lot of group exercise programs for these older generation, I have found is they are sticking on to the program is very difficult. They'll always come out with some excuse and say, today I had to go there, today I had this doctor. So if you have motivate them and bring them together for a good exercise program, it really improves. Another article which I found was a text message based social support intervention, which was delivered by the mobile phone. It was found it reduced pain and the pain interference levels. So what I'm really going to teach now is I'm going to look at, these are some of the exercise programs that I conduct. And if you can see me, this is me. These are the Zoom classes that I have done for the geriatric population. And you can see him, he's 70 years old. She's 67 years old. And these are about 62. And she is a lady with a hip replacement who is 70 years. And they're all doing exercises. And I continue to do these Zoom classes because of COVID-19. We could not come together, but I continue doing these Zoom classes for them at home. And this is another balance exercise which I continue to do with them. And I continue to do these exercises. So we are doing a certain amount of social isolation. This couple is around 68 to 70 years. So they have TheraBands, they have balls, and they have weights at home. So I add on all these exercises and I do for them. Now, we all have faced a problem with this, how to stay active during self-isolation. So nowadays we are using a lot of technology. So you have your own gym at home and set a routine to yourself. And at home, if people can get into some amount of hobbies, the geriatric population, it will really help them to keep active. Now, I'm just going to show some exercises. So I'm just going to adjust my camera slightly. So now I'm going to show you some exercises. I made the geriatric population sit on the ball because ball gives a lot of comfort to a person. And more importantly, it takes you back to your childhood. Whatever bouncing you have done, you start doing with the ball. So ball is one form that I teach them. And remember, when you sit on a ball, you're improving your balance reactions very well. So it is one form of exercise which Vaibhav already mentioned that we talk about balance. So I make them do very simple exercises. I just tell them to take their leg up, balance themselves, move their hands because they bring in a lot of oscillations into the movement, but continue to balance. So the balance reactions really improve. So this is one exercise I really make them do a lot. The other important thing that I really make them do a lot on the ball is the pelvic rotations. We have to understand incontinence is a big problem in the geriatric population. So I teach them a lot of pelvic movements on that. Start with a lot and it really improves a lot. Okay. Now the ball, remember, can be used in various forms. The ball can also be used as a resistance. So you just pick up the ball and you can do aerobic activities with the ball. Just keep doing this and you're pushing up your heart rate. Vaibhav, you want to ask me any questions, you can just go ahead, because then that will really. So I want all of you all to do something like this. Above the age of 60, you can play safe and you look at your, even in my TheraBand workshops, we always talk about you can bend your knees so you improve your aerobic activity some more. You can stretch, stretch, stretch. Remember, ball has weight, so it adds to the resistance. So you can use this as one of the activities that you can really enjoy. The other thing is, all my 70-year-olds roll on the ball. I will show you. They all roll on the ball and they can stay like this, or they can go forward to do their ab activities. All my 70-year-olds can do this because I have slowly started converting them to this level. You can see a small increase in my heart rate as I'm speaking. I'm breathing a little faster already. So my heart rate is already going on. Now, I use TheraBand a lot because it is very easy to handle. We have different colors in the TheraBand. So what I'm really going to show is, I'm going to show you something that's called as CLX. It's very simple. It has loops in it. So instead of using a TheraBand, if you buy this, there is something that is called as co-contraction in your muscle that occurs. So if you're going to use this, these are very simple. See, I'm just moving it. It is offering resistance. What is the advantage of using this? When I am doing this, this hand is also automatically contracting. That is why it's called as co-contraction of the muscles. So all you old people who are above 60 can start using these. I'm sorry. Yeah, the youngsters can also use this.
Definitely. That was what I was going to add. Even the youngsters can do the same thing. Probably the intensity is a little bit different.
The youngsters can also use this because I have different resistance bands. Now these are black color, which has higher resistance, that I'm going to use for my legs. So you can use these exercises to improve. You can do that, and then you can do this. You can pull it down. You can pull it down. You can pull it up. You can pull it up. And then you can use it even in standing. You pull it down below and then stretch your hands and stretch and these are the common exercises. But believe me, when you start using a TheraBand for the geriatric population, for all of you all, I'm sorry, not you, for all, whoever is above 60, it's very enjoyable because you can do a lot of exercises with the TheraBand. So I'm just going to show you some exercises. Do we have time, Vaibhav?
Yes, I think so. I don't know.
I'll show you some exercises for the legs, which are important and which are very good for whenever we are talking about exercises for the legs, we are always talking about a lot of core control. You always have to stand straight. The best part about this CLX band is, unless you have a good core, unless you have good balance, you'll not be able to do this exercise, which I'm going to show you now. You have to have that. Unless I have good balance, I cannot do this exercise. And my core is going to get automatically contracting. What is the advantage of doing these kind of, not only strengthens your muscles, it strengthens the opposite muscle. And this is an extremely good exercise for balance. We also have exercises like this we can do, and we can use various the movable surfaces. We can put it below the leg so that you challenge the exercise much more. You can even challenge the exercise by holding the ball and increasing your aerobic capacity at the same time moving, strengthening your leg. So see, these are some of the things that we can use for the geriatric population and make the group exercise extremely interesting for them. This is what I wanted to say. Vaibhav, you want to add on something?
Yeah, no, I mean, I just would like to add on some body weight exercises definitely the resistance exercises, the body weight exercises, body weight resistance, which we may not use in the geriatric population, may or may not use depending upon their capability and their ability. But I will just demonstrate a few, like the push-up, the squat and everything, because I don't have the equipments at home. I'm sorry about that. I have a stability trainer and a band, which I'll show you a bit. I mean, for somebody who is is on Zoom calls every day, somebody who's working from home and completely on the IT, because of the information technology you have at home and you're on computer, there are a few things which you got to do. The first and foremost, I don't want anybody who is work for a longer time from one place for a long time. I mean, at the most, you sit in one place 20 to 25 minutes, you get up, I'm just going to stand up there and show you a few exercises, which is basically, I'm going to just pick up a Teraban here. Ma'am, I just showed you about how to do the same thing I would ask to do, because you're always stooped and working on the laptop. So there will be a lot of aches and pain in your back, and somebody who's facing that, I would just ask them to hold the band in their hand, take a TheraBand like that, and just open up. Just open up, squeeze your shoulder blades together. So it is going to work on your shoulder blade, the muscles in between your shoulder blades, and strengthen them. It will get your scapula, the scapula here getting retracted, squeeze them together. It will help them. Similarly, you can hold the band onto your, you can wrap the band around. You can do to work on your scapular protraction. You can just do the punches. This is good for the upper body mobility. I mean, it will give you some thoracic rotation also. Okay. Similarly, if you have a partner, if you don't have a partner, you can ask somebody, you can just tie the band somewhere and work on your strength of the, suppose I'm tying the band there. I hold the band. I just kind of pull it and do some isometric contraction for the abdominals, doing a Pallof press. I do some rotations together. Similarly, these are various things we can do. And similarly, what ma'am showed in the lower body, the balance exercises, not only for the older population, but even people who are suffering through a little bit of backaches and all, they should be doing. Then the proper way to squat and do a push-up. That is also very important. If when you're doing a squat, it has to be ensuring that you are squatting in a proper way. So you can use the ball, the Swiss ball if you have with you, to hold it behind your back and then squat properly, where your thighs are getting parallel to the floor and your knee is at around 90 to 100 degrees, and you come up. So the way you're going to squat is basically, if I'm here, you can basically, if you're a beginner, you can start with the support of the chair and just squat down and up. That's the body weight exercise you can do for squatting. Okay. Once you get more confident, you can just keep your hands there and squat. That's the way. You can lunge for the lower body. You can just put your leg ahead and you can lunge. There. Okay. That's the lunge. You can do a deadlift, single leg deadlift, which I showed in the chart. Stand on one leg, balance on it, will improve your balance. You go down, come up. You can do these without weights, and if you have weights, you can start adding weights on it. So these are the various a few examples of these exercises.
Can I add one exercise to what?
Sure, ma'am. Yes.
This is called as Brugger stretch. This is basically for the people who are working on the computer for a long time. And all the computer workers, I teach them this. This is called as a Brugger stretch. And this, you just have to stretch it out, and your hand should go back slightly, hold it like that, and you should feel a certain amount of numbness that is going on in between your fingers, because you're going to put it into extension. Stay there for a few seconds. This is for all the young computer workers and the old computer workers. So remember, this is called as a Brugger stretch. Just take a band, put it behind. We do it in a little more scientific fashion. I'm not going to show it right now, but this is one of the important exercises as for Vaibhav's group of people. And Vaibhav, for my older generation, this is just to add on, for my older generation, I make them do a plank on the ball. That means 70-year-olds, because they have been, we have been conducting these classes for so many years now. My 70-year-olds do a plank on the ball.
Excellent, if they can do that.
This is what I'm saying. So motivation speaks a lot. Repetition of exercises speaks a lot. And how well you do your exercises speaks a lot. And most important, the message that I really want to pass through is start young.
Yes.
Build your reserves.
Absolutely.
Extremely important.
Absolutely.
And I think once you do that, I think, so shall we call it a day now?
Yeah, sure. Is there anything need to be discussed amongst?
Yes, I think we covered most of it. I think you were wonderful with the way you explained pain.
Thank you, ma'am. I mean,
and the way you went about the exercises and the Borg scale, very important. And I really love talking about the geriatric population. I've always loved working with them, so I love it. So I hope we've cut across some message on how to keep active, because exercise is the core of bane of movement, and without exercise, the aches and pains are definitely going to increase. So we don't want that increasing, and without exercise, your generation will not be able to function. So we all feel exercise should be done, should be a part of your regime every day. Is that the message, Vaibhav?
Yes, I'm just going to add something here. It is exercise, move. I mean, doesn't require any equipments also.
Absolutely.
If you can just move, you can use whatever you have at home. You use the chair, you use a step, a small bench. You can do a lot of exercises. Basically, that is for the resistance, but only doing active movements, doing active calisthenic movements also will keep you away from the stiffness and the boredom, what the body gets. Boredom not only mentally, but the body also gets bored if you just put them into one position and you don't move them. So that's the boredom which will turn out to be the pain. So it is better to move and keep moving, which is the key about avoiding the pain and keeping the pain away from you.
And thank you so much to Prajyesh. Over to Prajyesh.
Thank you so much, Prajyesh. Thank you. It was nice to host us, and thank you, Heartfulness, Wellness.
Wellness, yes.
Yeah, I mean, it was excellent. I hope we have put across the message what most of them who are listening today to us will take home and start moving as they can.
Yes, definitely. There is a very nice message that exercise is a very integrated part of our life, and you don't need equipments to do that. You just need to take care of yourself. And I hope that our audience will get benefit out of this webinar. Thank you for giving me precious time. And there are a few announcements for our audience. If you want to know more about Heartfulness Wellness initiatives, you can write us on wellness@heartfulness.org.
We actually, if there are any further questions, they can write to you and you can forward it to us.
Yes. And we do have other platform to connect with us. We have a mobile app. We have free Heartfulness magazines. And also we offer free meditation master classes. You can go through the description and you can find all the links mentioned in the description. Thank you again for your precious support and for this lovely session. Thank you, Dr. Aarti. Thank you, Dr. Vaibhav.
Thank you. Thank you so much. Thank you. Thank you for having us, Prajyesh.
Thank you.
Thank you.